Thank you. Senator McSally.
Thanks, Chairwoman Collins. I appreciate you holding this important hearing. Thanks to all of our panelists. We're all experiencing, our constituents are experiencing the challenges of the isolation that we've been talking about today. My mom's in independent living. I know she doesn't like me talking about her on Capitol Hill, but just trying to stay connected with her and help her through the process and getting eyes on her virtually. She's, again, in independent living, but has been basically isolated for months now. I did a window visit with a mentor who's in assisted living in Tucson, and just the challenges are very real in trying to stay connected with people, as we've been talking about, when the technology is just not the same, and sometimes the technology is overwhelming. And then we had one constituent contact me whose mother was isolated, had dementia, basically felt totally cut off and scared, afraid, and she passed away in this time frame. I think this is part of the cruelness of this virus, that we have individuals who are already vulnerable, who are isolated, and if they get the virus or have some other serious health condition, they are alone. And the nurses are doing amazing jobs to stay with them, but it's not the same as the face of your loved one, your family member. And as we move forward and we have increased our capacity for testing, I know there's concerns for bringing in visitors because we cannot have this population be more at risk. But I feel like we can't afford not to have the ability for visitors and family members to be tested so that they can be with their loved ones and have that human touch as they go visit them. And I also think there's a element of preventing elder abuse. It's underreported. The number of cases that are reported is a shocking number in America. And one of the best oversight mechanisms, in addition to inspections in the government, is the family showing up and being able to check in on their loved one and see how they're doing and focus on their care and see any signs and symptoms where there may be neglect happening. So if you could all share that it's not just about isolation, I think it's also about the preventing elder abuse and just providing that just the humanity of a loved one being with you. There's nothing that replaces that. Can't we get to that place where we can safely allow people to visit and hug with high situational awareness while protecting these most vulnerable from this awful virus?
This is Carla Pretty. Thank you, Senator, for bringing up these topics. Two things related to the elder abuse. One of the challenges has been around our understanding of cognitive impairment and how we define that and how our local agencies respond. There's often this assumption that people have the right to decline services and the right to self-determination. Self-determination goes out the window if you have cognitive impairment. So part of the solution going forward as we understand elder abuse is understanding the interplay of cognitive impairment and giving our agencies room to work with that. Related to assisted livings or independent living, thank you for bringing that up. Where we are here is that, as I mentioned earlier in my testimony, we are in a data-free zone and we need to work nationally to provide better guidance to these locations, because they're having to go to extreme measures because of fear of what families are going to say if someone's infected, fear of the media, and no guidelines. So the work ahead of us is really to develop those guidelines so we can safely allow you to see your mother, not just through a window. Where that policy came from is a little bit beyond me. I think it's been fear-based, and we have had to do that to keep people safe, but there is a middle ground. And I hope in these couple months, if we see a little bit of downtrends of transmission, we'll have some time before the next pandemic starts.
Great. Any other panelists want to share your perspectives?
So this is Peter Reid, and I would just share, I think, it goes back to kind of that ethical or philosophical tension that exists in really all areas, but balancing physical safety with personal autonomy and thinking about how we can maintain safe environments for elders while also enabling them to engage with family and friends, as you said, to get hugs, which are so critical. Physical touch is so important. Yes. And this is true not only in long-term care communities, but also in community-based supports and services. And this is a really challenging situation with the pandemic because we've heard the data. this has a dramatic impact on older adults. And as a public health professional, my advice is for all elders to continue to stay home, no matter what their states are doing in opening up opportunities to go out, and to take advantage of the technology and the services and resources that are being provided in their communities to help to maintain access to all of those essentials of everyday life that they need. But bringing families together in a safe and appropriate way, providing guidance on how to do that, can help us to balance that need of autonomy and personal safety and connectedness and physical safety. It's a challenge, though.
Great, thank you. I don't know where the time clock is here. I don't know where I am, but I do want to also just ask really quick about on the issue of telehealth. Senator Jones and I will be introducing legislation today. It's again a pilot project to increase the access, especially in rural areas, to remote patient monitoring. I mean, we've seen the benefits of telehealth. Again, sometimes that keeps you isolated, but it still gets access to the healthcare. But even people with diabetes and other things, if they can have that remote monitoring and it's under 2G or 3G or cellular coverage to be able to do that, just having that additional situational awareness to be able to keep the senior healthy and monitored. So any comments on expanding telehealth to include remote patient monitoring like our bill has?
This is Carla Pretty. Two things real quick. One, it's thinking about, is that technology accessible for older adults? Has it been tested? Has it been adapted for them? Two, over monitoring can be somewhat dangerous in older adults. So it's the balance between what are we monitoring for and what are our goals, and then just keeping autonomy and privacy in mind as we develop these things. But there's a lot of room and great to be thinking about this moving forward.
Great. Anyone else?
Sure. I would say that making sure that we do our part to try to eliminate the digital divide. Earlier, I shared some statistics in Philadelphia that with the older adults in the white community who have access to the internet, it's about 82%, and those in the African American community, it's 67%. That doesn't even touch on those that are impoverished. We're looking at people who are in Philadelphia that are at the 100% of the federal poverty level. They have about 52% internet connectivity. So anything we could do to make sure that we break that digital divide so more people have access to telehealth at this time would be tremendous.
Great, thank you. I'm pretty sure I'm over my time, even though I can't see a clock. Thanks a lot, Madam Chair, appreciate it.
Thank you.